Hello again, everybody. My name is Marty Guthmiller, CEO of Orange City Area Health System, on July 13, bringing you the 37th edition of the COVID-19 community briefing. Mostly statistical today, but I do have an update from the last time we spoke, which was July 9. And I think the last time we presented local scoreboard was July 6. And so I'm going to start out today with the local scoreboard, as has been our practice. We have 50 positives now, 50. Out of 859 tests completed, our positive rate has dropped to 5.8%. So it's a nice drop from 6.4%, which is a pretty low number to be sure. To put a little bit more emphasis on that, we have had 4 positive tests out of the last 142 tests completed. So that has brought us down from 6.4% to 5.8%. So very good news on the local front. Spreading out just a little bit to Sioux County, we have 505 positive cases out of 3,231 tested. That's 1 out of every 11 Sioux County residents have been tested. The positive rate has dropped from 15.9% to currently 15.6%. So the same trend is occurring at Sioux County as is locally, and so those are both good numbers. Region 3, stepping back. So again, to remind you all, I look at a couple things. One is not the number of positive tests, but rather the percent positive. So when you're testing a lot more, like 142, it is not so important that we had 4 tests positive. It is important that we had 4 out of 142. So the more you test, the more positives you are going to get. The second thing we look at is hospitalizations, and that we'll talk a lot more about that as a measure of the acuity level of patient or the severity of the infection. Region 3, representing 20 Northwest County, Iowa counties, have 34 hospitalized patients currently with COVID-19. That is down 1 from the last time we spoke on July 9 at 35. We do have 12 patients in the ICU, which is up 3 from 9 on July 9th. And we've had 3 admissions over the last 24 hours. So not totally bad news on Region 3. I would say probably neutral news at Region 3. On Iowa, again, we've had 2,600 positive tests since July 6th. That's a big number. But again, remember, how many tests did you do? Well, we've done over 26,700 tests. And so what that actually test rate shows is 9.4%, the same. And in fact, 9.4% was the positive rate the time before that. So Iowa has really stabilized in a positive rate perspective, the number of positives per test performed. We've performed 376,000 tests now in the state of Iowa, and that's 1 out of every 8 Iowans have been tested. And again, the positive rate is very steady at 9.4%. Now to get to the hospitalization number a little bit, again, the severity or the acuity level of the infections been going up a little bit. In fact, it's gone up the last 2 times we spoke. Well, it was 129 on July 6th, it was 157 on July 9, and it was 169 as of this morning. So we've had an increase of 12 hospitalizations in the state, so that's statewide, since July 9th. Locally, what that means to us is Sioux County has 3 currently, O'Brien and Lyon 0, Plymouth County 3, Clay County 1, Dickinson County 0, BV County 2. So Buena Vista continues to improve with only 2 patients currently in the hospital at this time. Woodbury County at 15, again, pretty steady there. They've been 14, 15 for a while. Polk County, again, relatively steady. They are at 31, and that's from 29 the last time we talked, and 31 the time before. The increase, again, as we mentioned last time, was more in the extreme southeast corner of the state, and I haven't checked that specifically, but my guess is that is continuing because our northwest numbers are pretty steady. There have been 13 more deaths since we've talked on July 9th at 752. So again, a reminder, this thing is not over. The marathon continues as we've been talking about. And I don't know if we're in mile 19 or 25 at this point, but we're certainly in that 20 out of 26 kind of range, hopefully. But we don't know exactly how long, how many miles of the marathon are left, so to speak. Just a little bit of an update on our IgG testing. We did test 50 people last week with 1 positive rate, or 1 positive result. So if you look at statistically, that would be a 2% positive rate. We have tested nearly 300 staff members also. And just FYI, that rate is less than 2%, more in the 1.6% rate. So basically, we've done a good job with our employees of not contracting the virus. And so this is largely our employee population basically is mirroring the public at this point, and maybe even a little bit less in terms of antibody presence. Just also a note on future testing. We are awaiting the arrival of our analyzer that will allow us to do our own PCR testing or the swab testing locally. Our ability to offer that is in part dependent on when it arrives, but you'll know about that when it gets here, and that will improve our turnaround and also be able to we'll be able to assist businesses, colleges, those kinds of things in the area with our own testing with a turnaround time hopefully quicker than what we've been receiving to date. So we'll let you know when that happens. Today's also a big day in senior care for us. We are entering officially phase 3 of a statewide plan in the nursing homes. And what that means in part, the biggest thing that it means for us is that families will be able to schedule visits now with their loved ones in the nursing home. So beginning today, those scheduled visits can be arranged. A couple things about that. One is we've defined family, and so it's family only, and it has to be scheduled. So you can get the details by getting a hold of folks at Prairie Ridge, but we're really happy. We'll be able to do 4 at a time. It'll be in the community room. Visitors will not be allowed back in the cottage area, and there's masking requirements and that kind of thing. But we're real excited to be able to get family members back face to face, not through a window or anything like that, but face to face in a room with their loved one. And again, that will be beginning today. So the next question is, well, what's next? What's phase 4 look like? Well, that's going to be a little while. I would expect to be in phase 3 for quite some time. Ultimately, the nursing homes probably won't go back to some degree of normal until a vaccine is present. most likely. It's hard to imagine doing more openness there, if you will, without a vaccine. And so I'm not certain that phase 4 is in that category yet, but phase 4 will be a little while longer. Another part of phase 3 is residents are able to eat together now, being socially distant from each other. I think we're 2 people at a table, 6 feet apart, but we're able to accommodate that. And so many residents are very happy that they're able to resume those, that degree of normalcy, if you will. So that is happening today. Again, this thing isn't over. We continue with the marathon. We continue to do our best to treat everyone and do so in a safe way. So we ask you, again, to stay vigilant, to stay strong and stay healthy, and take care of yourself, enjoy the outdoors, live your life, control what you can control, and live in a grace-filled manner. Thank you again for joining us today.